Hello, Craig Astor, running for U.S. Congress in the Kentucky 2nd District, which is in the heartland of Kentucky. And I live in Hodgenville, Kentucky, the birthplace of Abraham Lincoln. I live there with my wife of 27 years and our 4 children and a daughter-in-law and a grandbaby that's on the way. December I will be a grandfather, my wife will be a grandma, and we're excited about the addition to the Astor family. And one of the reasons why I'm running for U.S. Congress is because I feel that I owe it to my grandchild as well as future grandchildren to get involved in the political process, because I believe that the two parties has failed the American people over the past several years. And if we continue on electing the same two-party ideologies, which their programs has basically enriched the few, and the American people are struggling, and unfortunately the politicians just aren't listening to the American people. They listen to maybe their lobbyist friends. They listen to their the PACs, their donors, the big donors. Probably not so much the $100 or a couple $100 donors, but the ones that give thousands and thousands of dollars to their campaigns and re-election campaigns. And those are the ones that they're listening to. But the American people, they're failing to listen. And I think this can be seen over the issue of health care. Now, I am not a proponent of Obamacare, what they call Obamacare, that was given to the American people through the Democrat-controlled Congress back in 2009, 2010. But I do believe that the American people are wanting health care reform. And unfortunately, it is a problem that Congress has given us. I know that the one side, the Republicans, they like to talk about the free market and competition driving prices down. But let me tell you that we do not live in a free market capitalist system in America anymore. What we live in, or what we have, is corporate crony, probably socialism in a way. And it's probably not pure socialism, but it's not capitalism. And the reason why I say socialism is because it basically does take everybody's tax dollars and it bails out these that are too big to fail, and it enriches this corporation that those politicians might have stock in, which is definitely a conflict of interest. And by the way, while I'm saying this, that as an elected U.S. Congressman, I will not buy any stock or trade in any stock. And any of my campaigns or my staff, any members of my staff, they will not be allowed to buy or sell stocks based on any information that might come from committees. I am not wanting to go to Washington, D.C. to become a millionaire. I have no problem living my life and dying, and if that's a pauper, as long as I have some beans and cornbread and maybe a piece of ham once in a while, I have no problem with that. It's not my desire in life to die as a millionaire. And hopefully I'll die debt-free, but I just wanted to say that. But what we have now, as far as the health coverage, is a bill that is going to require certain individuals to buy health coverage because they say everybody gets sick, and no doubt everybody does get sick once or twice in their lifetime. Now, I know if you are into natural remedies and vitamins and herbal solutions and remedies, I know you're probably healthier than the majority of Americans that eat their processed foods and GMO foods and things like that, that we're not getting our nutrients and our vitamins like we should from the food anymore. And I understand that whole debate. But at the same time, this is a serious problem that we're facing, Because the way I look at it is that, first of all, Medicare and Medicaid, it is bankrupt. I mean, it's not sustainable the way it's designed right now. It's bankrupting our states through mandates. It's also underfunded right now, and will go bust as more baby boomers become part of that system of Medicare. And so we need to do something. And I understand that there were some Republican senators and even one from Kentucky that got up and said that what their plan was is to get everybody that was on Medicare, which are the senior citizens, to give them the same option as the senators who was able to get. And I don't know if they were just trying to buy or butter up to the votes of the senior citizens, but I'm like, well, why isn't it good enough for everybody? Now, I have a Cadillac plan. I'm a union employee with a big corporation, and I'm very thankful for my union negotiated health coverage that I have, as well as my family and my children. And one good thing about, and I'm going to refer to it as Obamacare, one good thing about that is it allowed some of my children to stay on that plan until they turn 26. Which I realize that the company has to pay for. Somebody's got to pay for it. But it is a blessing to my children that are in their early 20s. But it still does not address the problem of people that don't have any health coverage. And if you have health coverage, it's kind of like what Ronald Reagan said, that people that are for abortion are already living, meaning, yeah, you already have your life, but you don't want another unborn child to have their life. Well, if you have health coverage and you are against people that don't have health coverage from having a plan provided to take care of their life or get them well, then I'm kind of like, we need to look beyond that. And I understand the cost that will be involved. And I understand the debate about Canada and Britain and all these countries that have a socialized or a national health coverage plan. I realize that. And I realize that nothing's free. But let me just say this, that Craig Astor, my personal philosophy, well, first of all, my personal philosophy is that the less government we have, the better off everybody is. But we haven't had less government probably for 200 years. It's always been, the federal government has been continuing to grow and grow and grow, especially after the 1800s. Over the past 100 years, the federal government has just continued to grow in those programs, whether it's through FDR or LBJ in the 60s.